In a bustling hospital conference room, the faint hum of fluorescent lights filled the air as Dr. Sarah Thompson, a seasoned emergency physician, sat down with Dr. Mark Hayes, the newly appointed head of hospital operations. They were meeting to discuss the pressing challenges facing the healthcare system today. A pile of reports lay on the table, detailing patient statistics, staffing shortages, and rising costs. The conversation was poised to be intense, as both knew that healthcare, despite all its advancements, was facing unprecedented obstacles.
Mark, I'm glad we're having this meeting. The challenges we're facing in the ER are growing by the day, and I'm not just talking about patient volume. It's becoming harder to provide the level of care that we know patients need. What's your take on the current state of things?
I hear you, Sarah. Healthcare is at a crossroads. We've got advances in medical technology and treatment, but at the same time, we're struggling with underfunded facilities, staff burnout, and the ever-growing complexity of patient care. It's a balancing act that's becoming harder to maintain. How are things holding up in the emergency department?
To be honest, it's overwhelming. We're seeing more patients with complex, chronic conditions who require longer stays and more specialized care. The lack of staff only makes it worse. Nurses and doctors are exhausted, and it's affecting patient outcomes. What about on your end, Mark? How are you tackling these system-wide issues?
One of the biggest challenges I'm facing is trying to manage costs without sacrificing the quality of care. We're under constant pressure to reduce spending, yet patient needs are growing more demanding. And then there's the issue of healthcare access. Rural areas, in particular, are really struggling. It's hard to find a balance.
Question. Mark, what do you think is the most significant factor contributing to the current strain on the healthcare system? A. Staff shortages and burnout. B. The rising cost of healthcare. C. Increasing patient complexity and chronic diseases.
Answer. A. Staff shortages and burnout. Sarah, I think the most pressing issue is staff shortages and burnout, option A. Without enough healthcare professionals to meet patient needs, even the best technology or funding can't bridge the gap. Burnout is leading to high turnover, which only compounds the problem. If we can't keep our teams healthy and supported, everything else suffers.
The room falls into a brief silence as both ponder the complexity of the issues at hand, the weight of the healthcare system's demands hanging heavy in the air.
I completely agree, Mark. We're asking our staff to do more with less, and it's simply not sustainable. Every shift feels like we're on the brink of collapse, but I also feel like there's not enough being done to address the root causes, why so many healthcare workers are leaving in the first place.
That's exactly it. We're losing good people because the environment has become too stressful. It's not just about money, it's about working conditions, mental health, and feeling valued. What do you think could make the biggest difference in keeping healthcare workers from burning out?
Honestly, I think a lot of it comes down to systemic support. More mental health resources, manageable patient loads, and better work-life balance. And leadership has to take this seriously. It's not just about filling shifts. It's about ensuring we have a workforce that's healthy enough to care for others.
Absolutely. We also need to invest more in training new healthcare professionals, but even that's a long-term solution. Right now, we need immediate strategies to improve working conditions. Speaking of challenges, Sarah, what do you think is the biggest hurdle in providing quality care to patients today? Question, Sarah. How do you think we can best manage the increasing complexity of patient cases? A. Implementing better interdisciplinary collaboration. B. Expanding the use of telemedicine and remote care. C. Improving healthcare access for underserved populations.
Answer A. Implementing better interdisciplinary collaboration. Mark, I believe the key is improving interdisciplinary collaboration. Option A. When doctors, nurses, social workers, and specialists can work together more efficiently, we can manage complex cases better. Patients with chronic illnesses, for example, need coordinated care, not just a one-off visit to the ER. It's about creating a more integrated healthcare system where all the pieces work together.
As Sarah's words settle in, both recognize the importance of improving teamwork among healthcare providers. The brief pause lets them reflect on how true collaboration could ease the burdens their departments face.
That makes a lot of sense, Sarah. I've seen firsthand how disjointed care can lead to worse outcomes. Too often, we're all working in silos. Breaking down those barriers could improve care quality and reduce the stress on individual departments.
One thing I think we need to address is healthcare access. So many of our patients are coming in without insurance or proper care because they can't afford it. They end up in the ER because they don't have any other options. That's not sustainable.
I agree. The disparity between those who have access to regular care and those who don't is staggering. And it's not just about money. It's about geography, education, and public health infrastructure. If we can't address those gaps, the ER will always be overrun with preventable cases.
Question. Mark, what do you think is the most important step we can take to improve access to healthcare for underserved populations? A. Expanding insurance coverage and affordability. B. Building more clinics in rural and underserved areas. C. Offering more community health programs and preventive care.
Answer. B. Building more clinics in rural and underserved areas. Sarah, I think building more clinics in underserved areas is critical. Option B. If people have easier access to care, they won't rely on the ER for basic medical needs. It's about decentralizing healthcare and bringing it closer to where people live. Community health programs are great, but without the physical infrastructure, they can only go so far.
I couldn't agree more. We need to meet people where they are, not expect them to navigate a system that's already stacked against them. It's not just about providing care, it's about making it accessible.
Exactly. We've got to stop treating the ER like a catch-all for systemic failures. If we can build up care in underserved areas, we'll ease the pressure on emergency services and give patients a better chance at getting the care they deserve.
The conversation winds down, with both of them sitting in reflective silence for a moment. They exchange a determined look, understanding that these discussions are only the first step toward real change.
Thanks for this, Mark. I feel like we've got a lot of work ahead of us, but at least we know where to start.
Absolutely, Sarah. We've got to keep pushing for solutions. Our teams, our patients, they deserve better, and it's up to us to make that happen.
As they gathered their papers and left the room, both Sarah and Mark carried with them a renewed sense of purpose. The challenges ahead were daunting, but their resolve to reshape healthcare for the better had never been stronger. Here are 5 words and phrases related to the theme of challenges in healthcare.
Staff burnout, a widespread issue where healthcare workers face overwhelming workloads, leading to mental and physical exhaustion. Interdisciplinary collaboration, different healthcare professionals working together to provide holistic care.
Healthcare access. The ability for individuals to receive necessary medical services, which can be limited by geography or economics. Chronic diseases. Long-term conditions that require ongoing medical attention, contributing to the complexity of patient care.
Underserved populations, communities lacking adequate healthcare infrastructure, often leading to disparities in treatment and outcomes.